Your evening with us discussing the CariFree program. My name is Janelle, and along with my colleagues Krista, hello, and Chantel, hi, we will be sharing with you 10 things you didn't know about CariFree, and we hope you get a lot out of it. We want this to be as interactive as possible, but I see we have a lot of people signed on tonight. Just as a reminder, you are all muted, so we cannot hear questions verbally. If you have questions, please feel free to type them in the questions box on the right-hand side of your screen. We will do our best to get through as many as possible tonight. Any questions we do not get to on the webinar will be answered via email within the next couple days. Also, tonight we will open the lines here at CariFree for 15 minutes after the webinar to answer questions, schedule individual team webinars, and take orders. The phone number will be given at the end, so stay tuned for that. There will also be an exclusive offer. With that, I would like to go ahead and introduce my fellow Canberra consultant, Krista, and she will be telling you about our first CariFree fact.
Thank you, Janelle. So I would like to begin today's presentation with fact number one. There are over 50 schools nationwide using CariFree in some fashion. So there are several ways CariFree can be incorporated into a college or university. CariFree can be used in conjunction with current Canberra curriculum, or we can help start or grow a Canberra program in clinic. We can also assist in conducting research on biofilm activity using the CariScreen meter, research on pH and dental disease, intervention strategies, or even caries management, to name a few. There are currently over 50 hygiene and dental schools throughout the nation incorporating CariFree in some form or fashion. Some are doing research with the CariScreen meter, and others have implemented the full screening and treatment system into their clinic using both the CariScreen meter and CariFree product line. CariFree can be customized based on the school's Canberra goals. I would suggest if you're interested, visit our website for the complete directory and see if your alma mater made the list. That transitions into talking about fact number two. So fact number two is the CariScreen can very accurately measure bacterial ATP in a predictive manner. Numerous studies have examined the CariScreen meter and concluded it is a valid risk assessment tool in both adults and children. In fact, it's the strongest odds ratio risk factor based on Dr. John Featherstone's research. It helps identify whether a patient's decay is risk or bacterial, diet, saliva, or genetic based. So let's take a look at the how, the what, and the why. We have a lot of doctors talk to us about their patients with decay, saying they brush and floss religiously, so how can they still be getting decay? And the reality is that we need to point out it's not their situation doesn't entirely come down to their home care, but more importantly, what's happening with the bacteria or the biofilm. We all know that the biofilm is just a tight-knit community of bacteria that exists on our enamel. What we're actually testing for in the biofilm is ATP, or adenosine triphosphate. Many of you might recognize that as an energy molecule, and here's how that works for us. We know the healthiest mouth of all is still going to have billions, if not trillions, of bacteria in it. For the most part, we aren't concerned with the overall bacterial load. Acid-producing strands of bacteria are known to be very active, so they're emitting high amounts of energy. In fact, they emit about 100 times more ATP than what we consider healthy strands of bacteria. So you're probably asking yourself what type of technology measures ATP production. And the CariScreen meter uses bioluminescence technology, or more simply put, a light reaction. The test is quick and painless. You simply take a swab sample of the plaque from your patient's teeth, which when combined with special bioluminescence reagents within the swab will create a reaction, and you get your results within 15 seconds. And this may sound familiar to some of you. Let's say your patients, with decay are coming in. The dental team will develop a restorative treatment plan, and depending on the dental benefits and costs of restorative procedures, many patients ask to perform only part of the treatment plan. delay having the restorations performed, or schedule out the needed restorations over an extended period of time rather than having them promptly performed right there in the office. And this is not only a health risk for the patient, but it can also reduce your practice productivity. So there was a private practice study of 7,198 patients, and it demonstrated that approximately 2 out of the 3 patients with current decay have a highly active kerogenic biofilm. For these patients, the CariScreen can clearly clarify the importance of promptly restoring the areas of decay. It definitely places a sense of urgency. And so, extending the treatment plan could result in further breakdown of the tooth structure or, increasing the cost and invasiveness of the reparative procedure. The meter certainly is a vital tool in providing information on the behavior of the patient's bacteria and helps track progress with regard to treatment at those recall appointments. Your patients react in a positive manner to seeing this type of healthcare technology and are definitely more apt to be compliant with treatment. And a fun little bonus fact, CariFree's founder, Dr. Kim Cooch, is actually the world's leading authority on ATP as it relates to caries risk assessment. So that concludes fact number 2, and now I'm going to pass it over to Chantel, and she's going to talk a little bit more about ATP and how it relates to other industries.
Perfect. Thank you, Krista. Now that Krista has explained what ATP testing does and how it fits into dental practices, I want to shed some light to the fact number 3. Although ATP testing has only been introduced in the dental field within the last 10 or so years, it's actually been used in other industries since the early 1960s. Some of these fields may surprise you. For instance, ATP testing has been used in the water quality control field to reduce the number of outbreaks due to waterborne illnesses. You also probably wouldn't guess that hotels use ATP testing as well to ensure cleanliness and protect their reputation against outbreaks of highly contagious illnesses such as the norovirus. There are some major companies such as Walmart, Sam's Club, Campbell's Food, and 3M, which also use ATP testing to either fight against or protect their reputation against the negativity that comes with being tied to an outbreak. So speaking of bacteria, that leads me into fact number 4, which is talking about the ways that we can kill biofilm. There are 3 ways to completely kill biofilm. The first being complete mechanical debridement, which is impossible in the mouth. The second being heat in excess of 400 degrees, which would destroy the tooth structure. And the last being using a strong oxidizing agent, which is capable of penetrating biofilm. So since we know that the first 2 options are impossible, we started to focus on that third option. We have found that using 0.2% sodium hypochlorite, like we use in our CTX4 Treatment Rinse, works on contact, and it is the most effective broad-spectrum antibacterial agent that is safe for daily use. The other components of our treatment rinse I just want to quickly mention are xylitol, fluoride, and an elevated pH. Studies are showing that through short-term therapy using sodium hypochlorite and an elevated pH, it is possible to reduce, if not completely eliminate, kerogenic microbes from the biofilm and replace them with healthy organisms. So now that you know a little bit more about biofilm and our CTX4 treatment rinse, I'm going to ask Krista to discuss our research in a little bit more depth.
Thank you for that. So moving on to our fact number 5 and continuing on the discussion about the CTX4 treatment rinse, it has been put to the test literally. So a 3-year double-blind randomized clinical trial study was designed using the CTX4 treatment rinse and a placebo, or a standard 0.05% sodium fluoride rinse. They were employed on a 2 high-risk school populations in rural Queensland, Australia in 2010. No other instructions were given other than they had the children rinse once a day, 4 times a week at the school 9 months out of the year. After 3 years, it was found that the standard 0.05% sodium fluoride rinse reduced the overall caries index by 29%. More importantly, the population of children rinsing with the CariFree CTX4 Treatment Rinse had a reduced caries index of 73%. So this is significant data, just really driving home the fact that that treatment rinse is very effective when used as recommended. So now I am going to pass it over to Janelle, and she's going to talk about other applications of use with the rinse.
Great, thanks, Krista. So fact number 6 is that the treatment rinse is used for perio purposes too. We specifically market the treatment rinse for anti-caries purposes. The company is called CariFree after all, but we have many offices experiencing great results from their perio patients as well. For years, Jorgen Slots has advocated sodium hypochlorite as an antimicrobial agent to reduce bacterial load for treating periodontal disease. In 2002, he published a review article in the Journal of Periodontal Research that identified 0.1 sodium hypochlorite as a subgingival rinse. So this article was then followed up by the article here on the screen, published in 2005 in the International Dental Journal. This study was also looking at periodontal biofilms and the effect of a 0.1 to 0.5 sodium hypochlorite. Sodium hypochlorite is safe, doesn't produce any adverse effects or create any persistent bacteria, and we've been using it for a long time. It works really well and has a broad spectrum of antimicrobial activity and kills bacteria basically on contact. One big proponent for treatment rinse use for perio patients is Dr. Doug Thompson. Dr. Thompson is a clinical instructor and advisory board member at the Coy Center in Seattle. And he also travels the nation conducting seminars to educate dental professionals on the latest advancements in periodontics. In a recent blog series, Dr. Thompson actually explained how he attacks periodontal bacteria load using the CTX4 treatment rinse. So after scaling a root cleaning, Dr. Thompson irrigates all the pockets with treatment rinse and then sends his patients home with enough treatment rinse for the patient to use for the following 2 months. Now I'm going to pass it over to Chantel for a little bit of information about pH.
All right, thank you. So Krista, Janelle, and I have all worked in the dental field, and what we found most interesting when we were putting together some of the information for tonight is the fact that so many of the over-the-counter dental products that we're using and even recommending in offices are very acidic. We know that 5.5 is the critical pH level where teeth will begin to dissolve or demineralize. So the products that you're recommending to patients could actually be putting them in that danger zone. We definitely don't want to name any specific brands, as that's not our goal for tonight, but a quick Google search can find the pH levels of most of those products. And I do recommend searching for those from home and just seeing where those products fall on this pH scale. If your patient's mouth experiences a dramatic or long period of low pH, this can result in enhanced growth of cavity-causing bacteria. So just a nice way to remember it is how Dr. Cooch generally puts it. Prolonged or intense low pH in the mouth equals death of healthy bacteria or overgrowth of cavity-causing bacteria, which equals caries infection, which equals cavities. With the CariFree products, you can rest assured that everything you are giving to your patients will fall between an 8 and an 11 on the pH scale. So now I'm going to pass it back to Janelle, who's going to talk a little bit more about some of our products and pH.
Awesome. Thanks, Chantel. So fact number 8 is that CariFree products offer many benefits other than just preventing cavities. The CTX products can help with dry mouth, bad breath, remineralization, and even whitening sensitivity. So one of the most common questions that we get from dentists are looking for a better solution for their dry mouth patients, which isn't surprising when you consider that 70% of Americans take one medication daily, more than half of all Americans take 2 or more medications daily, and 20% take 5 or more. And this is from a study conducted by the Mayo Clinic in 2013. So it's safe to say that Americans are heavily medicated. So as Chantel mentioned, many of the dry mouth products available on the market are surprisingly very acidic. Here at CariFree, we offer 3 products, all with an elevated pH that will benefit your dry mouth patients. The first product is our gel. We have 3 different versions of this gel, one that's fluoride-free, one with an over-the-counter strength fluoride, and then this on the screen, our prescription strength CTX4 Gel 5000. So regardless of the gel you choose, they all contain glycerin, which is very moisturizing. The next 2 products, our spray and our gum, are also to be used for dry mouth patients as adjunct products throughout the day. The spray also contains glycerin, and it's to be used as needed. Just a few spritzes helps boost up the patient's pH and provide xylitol as well. Our CTX2 gum also helps elevate the oral pH, contains xylitol, and stimulates saliva, which makes it great for dry mouth patients. Next is bad breath. As we know, halitosis or bad breath can be caused by oral bacteria. Therefore, our antibacterial rinse, the CTX4 Treatment Rinse, will help your patients suffering from bad breath as well. And as far as remineralization is concerned, the CTX gels I mentioned earlier are also going to help with remineralization. All of our gels contain nanohydroxyapatite, which is a form of calcium and phosphate used for remin support. It's similar to other remineralization products, although we're using a crystallized form to optimize the amount of bioavailable nanohydroxyapatite crystals. Our gel is to be used as a toothpaste replacement, so it's a one-step process to gain remineralization, an elevated pH, xylitol, and fluoride, depending on the gel, all in one step. And then lastly, whitening sensitivity. In January of this year, a new study was published in the International Journal of Dental Hygiene showing the use of nanohydroxyapatite also aids in reducing bleaching sensitivity. And I know my teeth get really sensitive after professional whitening, and the CTX4 Gel 5000 really helps. So I was really excited to see this study. And now I'm going to send it back over to Chantel.
Perfect. Thanks, Janelle. Fact number 9 is that 69% of patients say that they are open to bacterial testing before they have even talked to you or your staff. We have collected data from practices that utilize our testing meter and our risk assessment form, and it gives us some great insight about acceptance rates. But before I go into too much detail about what you can expect, let me explain a little bit about our CRA or our CARI's risk assessment form. The CRA form will help you collect 3 data points: the patient risk factors, disease indicators, and the biofilm challenge. By knowing this information, you will have a consistent way to place your patient in a risk category, which will be used to create an individualized plan of attack for their treatment. When the patient first walks into your office without any prior knowledge or education on the biofilm challenge, 69% say they are open to having it performed. 61% say that if they were diagnosed with cavities, they would like to discuss treatment options. And 69% say they are even willing to modify their daily risk factors. We like to call these first 3 questions motivational interviewing. They are not a final answer, but they let you know how driven your patient is. Of patients who move forward with the biofilm challenge, over 43% will purchase a recommended 3-month kit of product. There's an unknown number of patients who also move forward with individual products, as well as the patients who choose the option to decline. Lastly, this form can be eye-opening for trends that may be happening in your specific region or area. For instance, of the 8,577 patients who completed this form at a private dental office, 55% of patients say that they take at least one medication daily. 59% drink sugary liquids more than 2 times a day, and 63% say that they snack between meals daily. So just think of all the helpful information you could begin to learn about your patients through using a Caries risk assessment form. Now, the last fact of the night will come from Janelle. She has some information to go over with you on our marketing tools.
Great. Thanks, Chantel. So last but not least, fact number 10 is that we will help you with marketing, as Chantel said. So for all teams who purchase the CariFree system, we offer patient brochures, and we also have a poster and video available for your waiting area. One really exciting thing that we offer are our press releases. These are free, and they're a really great way to let your patients and your community know about the new services you have to offer. We also provide pre-written content you can use in a blog post, on social media such as Facebook or Twitter, and pre-written newsletters and e-blasts for you to use.
Okay, and because you all have taken time out of your busy schedules, this is our special promotion. It's called the Starter Bundle, and it's our way of saying thank you for joining us today. This is a limited time offer, and it's on our 3 main products. So if you're looking at the screen, you'll notice you'd be receiving 12 bottles of the CTX4 Treatment Rinse. Again, that's an antibacterial rinse for high-risk patients. 12 bottles of CTX3 Rinse, which is a maintenance rinse supplying fluoride, xylitol, and a high pH. 12 tubes of CTX4 Gel 5000. This is a prescription strength dentifrice, and you'd also get a pack of educational brochures to pass along to your patients. So if you were to resell all of the product in this bundle at our suggested 40% markup, you're actually looking at a value of $684 on this special promotion. And this is an awesome way to get started right away with little commitment. It's going to allow you to begin treating a select group of individuals, and what better way to test the CariFree products and see the results firsthand. And again, so we're going to be leaving the phone lines open after this meeting concludes. If you are interested in ordering, give us a call and we can help you out. So we do have some time remaining, and it looks like we do have some questions coming in. So let's start out. I have the first question is coming from Dr. Foster in Massachusetts, and he wants to know how much is the CariScreen meter?
All right, that is a great question. The CariScreen meter retails for $19.95, and we do have a starting bundle which includes some free product that comes alongside with the meter itself, and like Janelle mentioned, some training and marketing information that would go alongside it. So if you want more information on that, what's included in that bundle, feel free to give us a call or send us an email, and we will send you all of that information.
Great. Thanks, Chantel. So question number 2, Dr. Howard asks, you mentioned the treatment rinse and gel, but what exactly is the CTX3 rinse, and who would I recommend it to?
Great question. So the CTX3 rinse can really be looked at as a maintenance rinse. So in my eyes, you know, this is what a patient is going to be using in place of an Axe or Listerine on a long-term basis. They are going to be receiving 0.05% sodium fluoride, 3 grams of xylitol, and an elevated pH with each usage. So this is a great rinse, you know, if you have patients starting on ortho, or if you have your high-risk patient who started using the antibacterial treatment rinse. Once you get that infection under control, you know, after, let's say, 1 to 3 months, you see them at that recall appointment, things are looking a lot better. That's when you can then suggest and recommend that CTX3 rinse for long-term to keep them healthy and in balance.
Great, and it looks like the last question coming in tonight that we'll have time to address is from Alicia, who's an office manager. She would like to know a little bit about insurance codes that are available. So Janelle, would you mind filling us in on that information?
Yeah, great. So we do have insurance billing codes that you can use, two different sets, I guess. So there's the one billing code that's for the CariScreen test that's using that meter, doing the chairside swab test. So we have one code for that. And we do also have 3 separate codes that are for that Cari's risk assessment. I know Chantel covered the risk assessment form. So if you're using that form for your patients, there's 3 different codes. One's for low-risk patients, one's for moderate-risk patients, one's for high-risk patients. So those are available to you, and they're something that's covered during training. So we'll provide you with all the codes so that you can bill those to insurance.
Thank you. Okay, so thanks again, everyone, for all your great questions. Again, any questions that were not answered today will be answered via email within the next few days. We really appreciate your time, and thank you for participating in this webinar tonight. The recording will be available for anyone wanting to share this presentation with staff or colleagues. If you would like to learn more about implementing CariFree into your practice, if you're interested in any of the products or the diagnostic tools that we've discussed today, we do offer one-on-one demos and would be happy to schedule one for your team. So we are keeping the lines open for the next 15 minutes. If you are interested in ordering that starter bundle that we mentioned earlier, scheduling a one-on-one demo, or if you just simply have more questions, call the number out listed on the screen, 866-928-4445. Chantel, Janelle, and myself, Krista, will be here helping you guys out. So thanks again, and have a great evening.